If it's okay with you, just give it another 10 or 15 seconds to see if anybody else comes in, and then I'll get started because I know time's really precious, but I'll just give it a few more seconds just in case we've got any slightly late arrivers. Thanks, Jane. Well, normally what happens in large meetings like this is you get a lot of people coming in 2 or 3 minutes, and you get lots of bonging, and actually we're very quiet this time, so I think everybody's pretty much come in. So I will start. Just want to say good afternoon, everyone. For those of you who haven't met me before, I'm Jane Coates, and I'm here representing Warwickshire Public Health today. My day job is as Warwickshire's COVID testing lead, and I am part of the public health team in Warwickshire. I do need to give you fair warning. I'm having some Microsoft Teams issues today. I'm not sure if they're weather related or whether they're tech related, but I may need to switch off my camera at some point because I've had my laptop's frozen a few times today. But do please let me know in the chat column if you can't hear me at any point. Obviously, I'll do my very best to continue despite the tech issues. So I'm just back from a fortnight off, and I understand from talking to colleagues this morning that it's been quite challenging in the early years sector over the last couple of weeks, particularly in relation to positive tests and the isolation information. I think it's fair to say that society as a whole is struggling with the lack of consistent messaging in the aftermath of unlocking on the 19th of July, and I expect there'll be a few more weeks of uncertainty to come, in all fairness. In some ways, I think this feels more difficult than other phases of the pandemic, and I recognise that you all as early years providers will be dealing with a really wide range of issues. I'll try my best, of course, to answer any questions you have, and you should continue to use the early years advisors, Education Corona and the Public Health Duty Desk email addresses for advice or information whenever you need it. I also want to thank you, to offer continued thanks for everything you're doing and have been doing to limit transmission and to prioritise the safety of people in your settings, both staff and children. You probably feel that it isn't noticed, and it is, and we're very grateful for the hard work that you put into maintaining safety. I've put some charts in the chat column that you can enlarge by double clicking. The grey bar chart shows the most recent 7-day case rates across the West Midlands, and the green bars represent the Warwickshire districts and boroughs. You'll see that our northern boroughs occupy the second and third places within the West Midlands region, with between 350 and 400 cases per 100k of population over the last rolling 7-day period. And that is pretty high, certainly in comparison to what was the state of play when I went on holiday a couple of weeks ago. The numbers have jumped around all over the place in the last week, going as high as into the 800s on some days about 5 or 6 days ago. So the numbers that you're seeing today do represent quite a rapid decline in the case rates, and we can only hope that they continue to go in the right direction downwards. The pace of the decline is probably seen a little bit more clearly in the pink bar chart. And thanks, Sonia, for pointing out again, if you double click on the image in the chat column, you will be able to enlarge it and see the graph in full size. I think the pink bar chart does show for Warwickshire how uncertain the landscape is. And this, again, I think is a really big contributing factor to the confusion around what is the right messaging, what members of the public and certainly the users of your services understand by quite what is going on. It certainly is quite challenging at the moment. Going back to the grey bar chart, you'll see that the other districts and boroughs, the case rates have shown a slight increase over the last 7 days, and that's at a gentler pace for North Warwickshire and then Eton and Bedworth, which I think it's fair to say generally have been at the top end of the chart over a longer period of time. I don't know about you, but I'm getting asked questions by colleagues and family alike as to why the national case rates are dropping day by day, when people's experiences is that they now know more positive testing people than they've ever known before at any other point throughout the pandemic. And the short answer is I don't have an answer to that. I do know that there's some national research underway at the moment to try and understand what is happening and to try and pick apart whether the sudden increase in self-isolation alerts has played any part in this, or quite what is going on. But hopefully I will have something to be able to feed back to you at a subsequent meeting. Anecdotal evidence certainly suggests that the recent peak, that the really high numbers that we've seen may be related to the Euro 2020 effect, with transmission happening where lots of people were gathering to watch the football. We certainly know in Warwickshire there were a number of outbreaks relating to settings that were showing football matches with that as a clear causal link. Following this logic, it might be slightly too soon to understand if cases will increase again as a consequence of the 19th of July, although I imagine we should be able to see whether there's a pattern there more clearly by this time next week. So it's really a case of watch this space with that at this moment in time. I really wanted to take some time today to reinforce the information that was shared with you at last week's meeting, which is around the Warwickshire specific recommendations and recognising where we vary from the national line. We continue to recommend 10-day isolation for close contacts of positive cases, whether this is a child or staff member, and that you as providers instigate the isolation advice rather than waiting for contact by the national NHS test and trace team. That just helps us plug that little gap that could be around 24 hours of people that might slightly fall through the net, and to help us really contain transmission opportunities as much as possible. Obviously, we recognise that DfE advice on isolation is different at the moment. So to try and avoid confusion as much as possible on the local approach, we really recommend that you direct all of your queries at the moment to the Education Corona team, the early years advisors, and then the DPH admin contact line, rather than going to DfE up to the 16th of August, bearing in mind that we recognise we're varying with them up to that point. So please do continue also to advise public health of positive cases using the online form that's been available to date and that you've all been really good at completing. So thank you for that. Close contacts and households are still being asked to book a PCR test through the gov.uk portal or by ringing 119. As a reminder, households of close contacts don't need to self-isolate while PCR test results are awaited, unless someone in the household has symptoms. If you develop symptoms of COVID-19, stay home and self-isolate immediately. If you have a positive test result but you don't have symptoms, stay at home and self-isolate as soon as you receive the results. And I'm afraid the households need to isolate too in that circumstance. People can only stop self-isolating before the 10 full days have been completed if they're contacted by the National NHS Test and Trace team and advised to do so. Otherwise, they must continue to self-isolate and follow the guidance. And I've already been very organised and put the link to the guidance documents in the chat column for you. So please do make sure that you're up to date with the most recently amended version. If you've been informed that you're a contact of a person who has had a positive result for COVID-19, you must stay home and complete the 10 days full self-isolation. Your isolation period includes the date of your last contact with them and the next full 10 days. This means if, for example, your last contact with a person who's tested positive was any time on the 15th of the month, your isolation period ends at midnight on the 25th, 10 whole days later. So again, the guidance that relates to that is in the chat column. In terms of close contacts of a positive person, it's worth being mindful of how your early years groups are mixing, especially given that grouping or bubbling isn't in place. The larger the mixing group, the larger the number of potential close contacts. Please continue to apply the good and clear logic that you've used to date and continue to work to the systems of control to limit transmission opportunities. Clearly, your individual circumstances are likely to change in setting from day to day as well as week to week, and you are best placed to understand which grouping measures are the right ones for you. As I mentioned earlier, do continue to use Education Corona and early years advisors if you want to check your thinking on anything. I have a quick final reminder that the Education Corona helpline has limited operational hours for the next few weeks due to staff holidays, and it'll actually be staffed between 9 and 2 Monday to Friday. Your early years advisors team are around every weekday between 8 and 5 and are still there and very happy to help you. And the public health duty desk remains available outside core hours and over the weekends. So really, as I said at the start, this feels like a very unsettled period, and anxieties often increase in line with a lack of clarity. Public health continues to ask you wherever possible to please do act as sensibly as you have done to date and isolate close contacts of positive testing people. We really just do feel at the moment this is the best way to bring the numbers down in Warwickshire. That's all I have to say today. So I'm going to move now to the chat column. My colleague Michelle from Public Health is actually here with me today and covering Fidelia, who's earned her holiday that she's on this week, certainly after a very busy term. Between us, we'll hope to pick up your questions in the chat column. So if you can bear with me a moment, I'm just going to turn to the chat column and see if I can pick up any questions. I don't know whether Sonia or Jessica is able to point me in the direction of any that have come in.
I can't see any questions, Jane, at the moment. But let's give people a chance to
we'll give people a moment. Yeah. Oh, thanks, Jess, for re-putting those links in. I think I wonder if mine didn't appear for whatever reason. Apologies.
No, they did, Jane. They just typed quite high up in the chat.
I really can't tell today whether it's Teams issues or whether there's something wrong with me post-holiday.
Okay. It doesn't look as though we've got any questions, Jane. And we've got a hand up. Karina's got a hand up. Karina, have you got a question? You might need to take yourself off mute.
Karina, we're struggling to hear you. So if you want to put
It's in the chat. It says you need to unmute me.
Okay, I can see a question now. Jessica, are you able to unmute Karina, please?
Yep, I have done. You should be able to unmute yourself now, Karina, hopefully.
Perfect. You've asked a really challenging question, which is, can you explain the science behind why once self-isolation period has ended, but I fear we may be missing the end of your question, Karina. I think we may be having multiple technical issues today. I don't know if anyone else has had torrential rain that's really upset their internet connection.
Here you go, it's there now.
Lovely. Can you explain the science behind why once self-isolation period has ended for a member of a household, the person can come out even though another person in the household then tests positive? To be honest with you, that is a really complex that's a complex explanation that I probably can't do justice to without writing it down. Otherwise, I fear I may make that slightly more complicated. So if you could give me some time to go away and draft something into a few sentences that is logical, I'd be very pleased to send that on to you. Oh, here we go. Michelle is even better. And if we can unmute Michelle, she can respond to that. Thank you, Michelle.
Hello, can you hear me?
Got you, Michelle. Thank you.
Yeah, lovely. Okay, so hopefully I won't confuse anyone when I respond to this, and hopefully I've understood your question. So if everybody within the household tests positive within the first isolation period of the first family member that tests positive, then they all just need to finish their 10 days as and when I suppose their day zero started. If a household member tests positive then outside of if the 10-day isolation period is then finished and then 2 days later someone else then tests positive in the family, or a week later, then the whole family would have to isolate again. So it's better to explain this more with examples, if that makes sense. So if there's a family of 3 and one test positive today, another test positive in 2 days, and then a day after that, then their isolation period would be it would kind of all be together, but they would all need to isolate individually for their 10 days, if that makes sense. So the first person that tested positive would need to finish their 10 days and then they're free to go. They don't need to wait for the second person and the third person. But if, like I said, another member of the family was to test positive at a later date after all those isolation periods are finished, then the whole process would have to start again. But it is very confusing. Hopefully that makes sense a little bit.
Yeah, I do think this is quite complex, and the whole scenario. We've had lots of questions about this right throughout the pandemic, and actually, Karina's gone on to add in the chat column, Michelle, to explain the scenario whereby a child is isolated due to father's COVID, but mother has subsequently contracted it. And my sense is that actually those are separate. It's separate. The 10-day self-isolation begins again.
Sorry, can I just interrupt? We've got the flow charts on the toolkit web pages, which I think it's hard to make sense of it when you're listening to it, isn't it? I think so. If people are a bit confused, have a look at the flow charts, because they really do explain it quite well. Not that you're not explaining it well, Michelle. But,
it is confusing. But what I would say is, if anyone does have this scenario happening, is just contact us, talk through as the example, or Education Corona, and talk through the example, and we'll be able to assist. But the reason why as well is because they have to re-isolate if it happens at a later date, if someone then tests positive. It's because it could be a different variant, or it's not within the same infection. So it could potentially be a new infection if another person in the household tests positive outside of the first lot of isolation periods that the family have had to have.
I think Karina's point does articulate a number of frustrations. This is difficult, and I think the approach that government and PHE have taken really is very one size fits all to this, and unfortunately some people get caught up in it multiple times. But ultimately, the idea behind the isolation period tries to take account of the amount of time it can take for some variations of COVID to incubate in people, and how long it might take for symptoms to appear. Certainly, some of you might remember in the early days of the pandemic, it was a 14-day self-isolation, but was then dialed down to 10 days for all but social care settings. But I think that is now 10 days across the board. But yes, absolutely recognise there's frustration with this. I don't see any other hands other than Karina. I'll just give a moment for anyone else who may have a question. Oh, thank you, Sonia. That's really helpful. I was going to go away and Google that picture actually, although I think it explains what you need to do, but not necessarily why you're doing it.
Not the why, no.
Yeah.
Okay, can I just say thank you very much to both Jane and Michelle for joining us today. These meetings are really, really useful. So we will keep going with them. We weren't sure how many people would turn up today, were we? Because I know colleagues are very busy and some people are on holiday and things like that. But thank you both very much, and thank you everyone for joining us. Jessica, do you want to say something about where the meeting link will be and things like that for the recording?
Yep, so all of the recordings are kept on our COVID-19 pages on our website, so it's you can follow Sonia's link and they are on there, but also in the email reminders that are sent out, I think I've put the link in there so you can watch back any recordings if you need to. That's
Lovely.
me.
Thanks so much to everyone for your time, and I'll look forward to speaking to you again the next time.
Thanks everyone.
Thank you.
Bye.
Bye.